Front Office Rocks, and somebody was talking about their checkout process, and they were talking about the hygienist doing everything in the back, or the assistants or whatever. And they were talking about letting the patient go, and then the front office team would follow up to schedule their next appointment. I highly disagree with that. Like, I think we shouldn't forget the foundations of the things that we've been taught. So huddle is a really good, like, if you have not been doing huddle, this is a perfect time to bring huddle into your practice. But the other two things is, I think that we should figure out the financials with the patients prior to or at the time of service, and we should be scheduling their next appointment. And her reasoning was the dental assistants may not know how long for an appointment, or what. We can call and change it. We can call and adapt it, but it's better to have the patient leave with an appointment than not leave at all. And so Sherry was just mentioning in comments that it'd be best to collect prior to any treatment. And that's great. That's where the huddle in the morning, we could talk about, this is going to be their balance. This is how much they owe. Let's call and they could be sitting in their car before they walk in, and we can get their credit card and run their credit card for them. So I think those are really good tips to make sure that we don't want people to leave without appointments. We don't want to look back 2 years from now and go, oh my gosh, COVID messed up everything in our practices. Christina, you have a thought?
I think that's such a great thing to bring up is right now, if I want a cup of coffee or anything from anywhere, I give them my credit card number over the phone. Like, everywhere that is becoming the social norm. And I think sometimes in dentistry, because, we're service oriented, we step out of that realm and we think, no, like, that's not how we can handle things, but we have every right to handle it the same way that retailers do and coffee shops do. So, be okay with that being the social norm right now and saying, okay, this is what our estimated payment is. I'll take your credit card information now. I'll run it at the end of the appointment. And if there's a change, we'll let you know in advance, of course. But that way they have the estimate, because, the last thing we want to do is fully run it and then be like, you actually owe $10 more. Like, that drives people crazy when it's like, even when it's $1 more, you owe us $1 more. Right. So, saying like, we'll take the information now and we'll let you know if there's any changes. That's just a great flow and get people used to that. And then in advance too what their expected payment is. So if they're like, I want to pay by check, I want to pay by cash. Are we handling cash right now? Are we handling checks right now? And there's no right or wrong answer to that, but that's something to know as a practice. Are we handling checks? Are we handling cash? And if we are, how are we doing it? Because our front office team is not usually, some are, but not usually trained in donning gloves and how to properly take them off and what not to touch and the full infection control protocol of that.
Right. I think that's great. And Chastity, we talked about this last week a little bit, but I'm actually leaning towards right now as we're talking, because I'm kind of coming up with my theory on this too. Not only a morning huddle, but like an end of the day powwow to see how things went. And can you talk about that? Like, what do we want to kind of look at the end of the day and say? Because I think there's going to be some days where like, wow, that did not go well.
Yeah. As I said in the beginning, I said our practice is coming up with like the concrete plan. And the reality is that there's nothing concrete about it. Like, it's going to be forever evolving through this situation to try to figure that out. So a morning huddle and then an end of day, just to touch base and say, hey, how did it go? Because communication is definitely going to be our strongest thing to lean on, is communicating with our teams to know what protocols are working. What is it that needs to evolve or needs to change to reduce any risk? What kind of created like a bottleneck in the day that just added more stress, and we could do it in a more inventive way that reduces that. The only thing I would caution with the huddles is we also want to make sure that we're complying with any social distancing factors as well, just for the time being, is because there are some of those restrictions with ensuring that we're trying to keep space within the practice as well. So having that as part of the plan, but knowing that things are going to be fluid, goof ups are going to happen that don't feel like they went as well as we think that they could have or didn't envision them going, and being willing to just move forward from that, be creative, come up with new solutions, new processes, and having that understanding for one another.
Yeah. And I think I talked about this in another webinar I did last week, and I think we've talked about it a little bit, but we're all brand new. It's like we're all going back to a new job at the exact same time, right? So Christina, I know that everyone feels confident in their jobs. I am the best hygienist. I am the best office manager. How do we check our egos at the door right now? What thoughts do you have about that? Because this is good. Not every checkout's going to go amazingly, and somebody's going to drop the ball or something's going to happen. So how do we leave our egos at the door right now?
I think you're asking me this question because I'm a status-driven hygienist.
I mean, if we work together, we would have to sit down at the end of the day and be like, okay, let's check in.
Yeah, because, I've always said that. It's like we, as a hygienist particularly, I have a structure, I have a schedule, I have a routine that I really like to follow. And right now, it's going to be completely a new routine. And so what will happen is every single day, even right now, is I run through my day, what it's going to look like and how is it going to happen. And so have those days actually happen? No, like it's just been this consistently changing thing. So what's really important is for each other, having this empathetic space for each other to say, like, it's okay to mess up. Like that's actually going to be part of the routine is, acknowledging like, hey, what could I have done better every single day should be part of your daily routine right now. So what did I mess up? What can I do better next time? Okay, that's part of my check-in system with myself right now. And just having that empathetic space for yourself and for each other to be able to accept that as the current norm, and that has zero reflection on you as a provider. So there's a difference between you as a person, you as the routine that you're doing, and you as a professional. So making sure to kind of separate all of those different buckets so that we're not letting it bring ourselves down, because it really can. And from, a perspective of a hygienist looking at our front office team, really also having that space for them. What we don't want to have happen is having any animosity in the team saying like, I'm having to do so much and you're not having to do much. So I've already heard so from either perspective where it's like, all they have to do is, PPE. That's the only thing that's changed for them. I have all these things that have changed. Or vice versa. You're like, all they have to do is ask screening questions. Why can't they do more? Why do we have to do all these other things? So there's lots of that that's going on in the practice. So just knowing that everyone, like you said, is going through something new. This is different. We're all just starting over and just figuring it out together as a team and really holding that space for each other to say, it's okay. Whatever we didn't do well today, we're going to try again and do better the next time.
And actually, you brought up a really good thing, and I'm just putting this out there live on Facebook. You're not going to find this. Like, I'm just winging it here, but I have very rarely seen anything from dental assistants. I don't know if I'm not in the dental assistant groups, or, I'm seeing hygienists in conversations. I'm seeing doctors and leadership and my team and team members, front office team members. So, that's a kudos, I think. Or either that or I'm not in the dental assistant group. But that's the thing, is we need to come back and realize that it's not us against them. It's all of us against COVID, right? And what's best for our patients. Chastity, what about you with regards to just kind of leaving the egos at the door and coming in as a full team?
It really falls down to redefining what a successful day looks like. So we all have these visions of success looks like, for the front team, it might be our collections and what our schedule looks like and making that it's full and people are pre-appointed and paid for. And then for hygiene, it might be that we're pre-appointing our patients, our hygiene schedules are full, everything flows smoothly. But during this time, that might not be what a successful day truly looks like. It may be that our schedules are falling apart, or there might be restrictions on how many patients we can see. So there's really a whole new capacity for what a full schedule looks like. So being patient and understanding that we're going to have to redefine what that vision looks like to make sure that we're keeping that in check as well. So we're not thinking that anybody is failing within their roles or that we ourselves are failing with other roles. There's limitations that we have no control over right now.
Right. So I think last thought, unless we get any other questions, and Zara from Texas says hi. So thank you for joining us, Zara. I'm recommending for dentists. Okay. So now we're all on the same page here, but I'm recommending for dentists for hygiene that is opening to give them extra time, because there's a couple in PPE. We also want to build that rapport with our patients again. Everybody's had a huge change in their life. It's a great time to remind them how great our team is and everything, and then allowing time for turnover. So I'm suggesting for a normal hygiene appointment, and it really depends on your practice, of course, right? But give them an hour to do hygiene and then give them 10 minutes between appointments to turnover. Is that, Christina, in line with what you would suggest to allow us not to kill ourselves and really be able to get through the day right now?
I wish that I could give like an exact time. Like I could be like, okay, so we have calculated how long it's going to take to flip a room and put on your PPE, and this is exactly how much time you need. And there is no science to this whatsoever. I think we can all probably agree that 10 minutes, it's going to take us at least that. So to gain that during this time of, figuring out what the new norm is would be so ideal because, we don't want to eliminate, the quality of care. And the majority of our hygienists right now are being asked not to do aerosol procedures. So they're being asked to hand scale where maybe they would use an ultrasonic, and that includes selective polishing instead of polishing. So we're trying to get off more stain that we could have probably just quickly polished off. So there's a lot of changes in our technique too that those alone take more time. And then on top of it, you have PPE. And so I think that question, when you ask it, you don't want to ask it too open-ended to hygienists, because one will say 10 minutes, one will say 20, one will say 30, one will say another hour. It depends on the practice specifically, but definitely having a conversation with your team about how much time do you think this could be, and then just evaluating it. Just like we said, having those end of day meetings to say, is this working? If you were running 30 minutes behind, is it because we actually needed an extra 30 minutes in here, or was it just one flop that kind of dragged us down? And don't forget our assistants. So like you said, if the doctor is saying, I don't need any extra time, like whatever, this is no big deal. Well, the assistants are flipping their rooms and setting up and getting the patient. So making sure that we're not forgetting them too, and that the dentist might not need extra time to do their procedure that they've always done, but your assistant probably needs a little extra time.
And I made that comment when I started with the doctors watching this, because I think that's something everybody can agree right now, even the front office team members. I think we want to get people in, back to you guys, and we want them out and scheduled and paid before the next one, if we can do that for a while we're getting through this new norm. Chastity, what thoughts do you have on that?
There's another component too of considering where you are. What is the incidence of cases of COVID-19? What phase of reopening are you in? And also preparing for knowing that this is kind of like a soft opening. So as we begin to open, we may have to kind of rein back in. So we also don't want to set ourselves up in the sense that we fill that schedule up and then 1 week later we realize that cases are going back up and they're wanting us to rein things in. And then we're back in that really challenging situation of trying to then cancel patients and move them and create that headache. So knowing that there's going to be that phased process, and that's really within understanding where your state is, or even what county you're in within the state, because there's so much variance on what that looks like depending on your location as well.
I agree. And the one thing I'm seeing for this, the offices that have already opened, and I've kind of talked about this when it comes to scheduling, the patients who are coming in now are probably your least fearful patients. They're more adapting. They're not as, the ones that are really in fear are going to push themselves out or want to schedule. So that gives us some time to kind of get a flow going. So just knowing that, they're adapting with us. The other thing I can tell you, I just talked to a dentist this morning. Nobody's actually reading these amazing emails we're sending. Nobody's listening to the text messages. They're going up, they're grabbing the door handle, and they're walking in without a mask on. So we are going to have to realize that all of this communication is important, but not everybody's listening. And so that's where it's important. I think the team comes together at the end of the day and say what's working and what's not, right? So, okay, Christina, any final thoughts on this was our checkout? I know we didn't solve it, but I think we talked about the things that you should talk about with your team. So Christina, any final thoughts on that?
I think just with everything right now, it's just meeting with your team, whether it's virtually or in person. The last thing we want to do is, get there and say, we'll just figure it out, because we're also talking about our patient's safety and our own safety. And also, creating that security and that great feeling that our patients normally have when they come to see us. They want some sort of consistency, and the best that we can do to create that for them, the better. Having connection points with the front office team and not completely eliminating it, I think is really important. As people skills trainers, we talk about the face, the smile, being able to have that connection point with people. And unfortunately, we're going to lose some of that in the back because we're going to be in so much PPE. So not eliminating front office connections. We've just said, a lot of practices have said, let's just, do everything in the back and we'll just get them out of here. We still want there to be some sort of connection with the practice, with a person, with a friendly face that they know, having conversations that they're used to. And remember that at the beginning of an appointment and at the end of the appointment is what you remember the most. So they might not remember all that pee and scraping that we did in the middle of the appointment, but what they're going to remember is that they got an amazing greeting from Laura and they got an amazing goodbye from Laura, and that, started and ended their appointment. So make sure you still have that for your patients. And as a team, you create this protocol together and make sure that everybody feels confident and comfortable with it moving forward.
Exactly. I love that. And I think it's very easy to, a smile goes 6 feet, right? So I can wave and give a smile and that's going to go 6 feet. Chastity, what about you?
Christina touched on all of those key components. Is it's knowing that even though we have all of these added tasks, just like you said, the patient walks in the door, even though they've gotten that like phone call and the paper and it's on the door, a lot of these things are really overwhelming, and we get into this cognitive tunneling where we're like so focused on what it is that we have to do that we forget about those interactions or forget about looking at the sign that's right there. So making sure that we're taking those moments to pull ourselves out of the chaos when we can, just to have those face-to-face interactions and be able to touch base even with our team members or our patients, knowing that we're all going through a lot of uncertainty, fear, challenges, chaos right now, and just having that smile, saying hello, and creating that rapport that we may have lost a little bit of during this time.
Exactly. So let me just kind of give everybody a couple of resources here. So as you can see, this is a conversation we're all having and it's going to keep going. And so Christina and Chastity and I are going to keep going on this conversation or whatever comes up, because there will be things that will come up. Just for anybody watching, we have a landing page, a website at Front Office Rocks, and it's Front Office Rocks, and it's called Rockstar Restart. So we are trying to pull everything together, including the amazing webinar that Chastity and Christina did that we have the link to on here from the Dental MBP. We have all the newest guidelines. We're getting tips and tricks from our members who are like, hey, wear your hair in a bun here and not here because it feels better. And I'm following all the groups out there. If you're an office manager, I suggest you follow ADOM, American Association of Dental Office Management. They're amazing. We had somebody on there who just gave an idea, which I think is great. And I'm going to share this with you guys. They did like laminated name tags or somewhere in the room where it's the picture of the hygienist, it's their face. And it's like, hey, it's Christina, because they're going to miss that smiling face, so just share ideas. That's what we're going to do with the Rockstar Restart page. So definitely check that out. We have another live coffee talk next Friday, and I don't know what we're going to talk about. So if you watch this and you have questions, if you have thoughts of what you want us to talk about, we've got a half an hour scheduled Friday the 22nd, same time. So we will see you guys at that. And then one other thing I want to bring up, Chastity, you mentioned at the end of the day, like when we said doing a regroup at the end of the day and being careful of social distancing. One of the things that I think too is that not everybody on your team is going to be back and involved in everyday activities. So maybe you want to even keep the Zoom meetings going with your team at 7 o'clock or 7:30 after everyone's gone home and fed their kids and taken their showers. Let's all jump on a Zoom call, because that way, even if the team member wasn't in that day, they can hear how things went, because we need to move forward as a team. So hopefully between Christina, Chastity, and I, you've got a tip or two that you can use. So at this point, I just want to thank you guys again for joining me today.
Thank you. Thanks, everyone.
Thanks for having us.
Awesome. Great. And if you watch this, have comments, questions, please share this. And we will see you guys again next Friday, the 22nd at 11 a.m. Pacific. So we'll see you guys then. Thank you.